Infertility is caused when one or more of the essential ingredients to making babies is at fault or less than it should be. What we do as far as infertility treatment is not rocket science, as I keep telling my patients. We need an egg, sperm of adequate quantity and quality, and somewhere safe and suitable for these two lovely things to meet. That's the fallopian tube. If the sperm in short supply or absent, if the egg is not released or is run out, or if the fallopian tube where the sperm and the egg meet is not accessible to the sperm and the eggs to meet, then there will be difficulty conceiving or infertility. If the problem is with the fallopian tube, we call it infertility due to tubal problem. If it's to do with the sperm, we call it male factor. If it's to do with the egg, we call it lack of ovulation. In some couple, about 1 in 4 of the couples that we see, there will be no discernible issue with the tube or with the sperm or with the egg, and then we label it as unexplained. Those particular couple, if they continue trying for a little bit longer, they may have a baby without needing our help. But if they have been trying for much longer, then they might need the help through some fertility treatment to overcome the difficulties or the obstacles to them achieving a pregnancy. Again, it depends. When the sperm is low in quantity or in quality, the most suitable and successful technique is to bring the sperm closer with the egg outside the body, which is IVF or test tube baby treatment. But for this particular indication, the embryologists in the laboratory have to inject individual sperm into each egg, what is known as ICSI or intracytoplasmic sperm injection, and then you overcome the issue. If the couple have been trying, say, for years, even without any discernible problem, the pragmatic answer is to try to give them IVF, where you mix the egg and the sperm outside the body in a dish or test tube, and then take the fertilized eggs or embryos and put them back inside the lining of the uterus. So there are some treatments that are not as demanding or high-tech as this, where if the woman does not release an egg regularly every month, like when they have polycystic ovaries or polycystic ovarian syndrome, giving them some tablets or pills to trigger or to stimulate the ovaries to release the egg can be all that is needed to help them achieve pregnancy, and it's relatively successful treatment for those couples. So there is a variety, and there is no one size fits all. It's important to make the right judgment to give the couple the appropriate treatment for them. IVF is effective provided really that all what is required is in place. And the most important determinant of success of IVF or ICSI is the age of the woman. Because at younger years, under 35, really you would expect 50% of them to have a baby from the first attempt. If they have extra embryos frozen for their use and they didn't have joy with the first attempt, they can use some of their frozen embryos to give them another lifeline. So it's really relatively successful. However, if a woman embark on treatment using her own eggs at age 44 or 45, unfortunately, the odds are not that great, as you would be talking about 1 in 20 chance of having a baby from one go at IVF. I think it is fair to say that in 2021, IVF has been made a lot safer than it used to be 10 years ago, not even 30 or 40 years. And the two main complications of IVF, one, when the ovaries go over the top in response to the medication that we give to make the ovaries produce as many eggs as safely possible. And that is called ovarian hyperstimulation syndrome, where the woman can get really sick and her ovaries become like the size of a football and stop producing urine and have to be admitted to intensive care in extreme situation, this has become a thing of the past currently, because there are ways and means of producing or providing effective and extremely safe treatment that can virtually eliminate the risk of this syndrome. The other main risk is multiple pregnancy, because with multiple pregnancy, all the risks of pregnancies are magnified and accentuated. And now even this can be reduced if we adopt a policy of putting one embryo at a time inside the uterus. And this is what is happening. In this country currently, the rate of multiple births is under 6%. And when you compare this with maybe 15 years ago, it was 1 in 4. So it has been made a lot safer than before. So other than the minor side effects of the medication, there are no serious complications when the treatment are offered by a responsible practitioner in the right facilities. If they had a diagnosis which showed that the tubes are blocked, if they had a diagnosis that the sperm is very low in quantity or quality, and if they have been trying for a long time, say 3 years or more, regardless of the cause, then assisted conception using IVF would be highly recommended.